Hi,
Hello,
good evening, everyone.
everyone.
Thank you so much for joining.
We're just going to share our presentation with you and then we're going to get started right away.
Whilst Ruby's doing that, it's lovely to see so many people. You can see at the bottom of your screen, there might be lots of emojis. If you want to get involved, you can click it. There's times where you can put your thumbs up, you can smile, you can share some celebrations. It all helps us to see your thoughts about what we are talking about here. And tonight we are talking about what's going on with my child's focus and emotional regulation.
Okay, so we're going to get started right away so we can cover all of the content tonight. So firstly, what are we going to cover? So we're going to cover a wide range of topics, from why children have focus and attention difficulties, what's really going on behind emotional reactivity, all the way through to co-regulation and supportive strategies. But we've interwoven your pre-submitted questions into the content, but also they're going to pop up like this. So throughout the presentation, you're going to see your own questions, and hopefully we can give you some really good answers that you can use to take away with you tonight. So Dr. Daniel Weisberg, we are so pleased to have you with us for this hour. Dr. Weisberg is an expert in his field, and we are really lucky to have him with us to share his insights and clinical insights and also practical strategies. So without further ado, Dr. Weisberg, would you like to introduce yourself?
That is very kind of you. Yep, I'm Dr. Daniel Weisberg. Dan is absolutely fine. I'm a consultant clinical psychologist. I specialise in working with children, young people and adolescents, and our job is to try to get the best possible understanding of what's going on for them at any one particular time. And tonight our thinking is all about their attention, concentration, emotional responses, and we will take you through that step by step. Before I do, let me tell you a little bit about CAPE and what we offer. So CAPE Psychology is a psychological healthcare service for children, adolescents and young people. We offer psychological therapies for a wide range of difficulties that children might experience, but we also offer specialized assessments such as assessments for autism, ADHD, learning differences, dyslexia and dyscalculia assessments. We offer supports for parents, tonight being one of the ways that we can do that. And we also offer support for parents who are trying to navigate the EHCP and Education Tribunal landscape.
So throughout this session, we've got 5 sections, and the first section is about understanding focus and attention difficulties.
Great. So I suppose the best place for us to start is one of the biggest misconceptions about attention and concentration. Focus is not about motivation and effort only. If we only think about it from that point of view, we're missing a big picture here. Focus is is a skill. It's a cognitive skill that relies on multiple systems that we are dependent on, including executive functioning. It's one of those terminologies that not many people can get their head around, probably because it requires lots of executive functioning, but it's the terminology that we use to describe all of those higher order thinking things that we need to do. Think planning, working things out, sequencing, impulse control. You know, if someone gives you a present and they're right in front of you and it's a rubbish present, we have to say thank you. But that impulse to say, oh, this is rubbish, is something that we have to resist. That's all executive skills. Similarly, it relies on working memory, this ability to hold things in your head at any one time. It relies on regulating your emotions. It relies on the environment. Essentially, lots of different systems need to align together in order to keep your focus on something. And when just one of those systems is under strain, your focus becomes much, much more difficult.
So thank you so much. So we have our first question submitted by one of the parents here tonight, which is, why can my child not follow simple instructions even when they seem so capable?
And this is one of the most common questions that we get, because this is essentially saying something is going wrong here. My child's got the ability to be able to do this, but isn't actually doing it. So what is going on here? And essentially it's because of something within all of those bullet points that's on the slide beside you has gone a little bit haywire. Something has changed here. The demands are a bit too high. And so it means They've heard what you're saying. Their hearing is absolutely fine. There is just a problem with the processing of all of that information, which means they're not doing the thing that you are hoping that they would be able to do. And we'll go through what that might look like shortly.
Yeah, I would really encourage you to write in the chat if there's anything that we talk about here that you're really struggling with as well, and if you have any tools as well that have worked for you or that aren't working at the moment. So the next section about understanding that is thinking about the developing brain.
And this is essentially why we might see this so differently to how children see it, because we have developed brains, children don't, particularly the frontal parts of their brain. So this is called the frontal lobe, and part of it is the prefrontal cortex, which is essentially the area of your brain that is essential for attention and impulse control, decision making, organizing yourself, all of those executive skills we talked about. The challenge is this is a part of your brain that develops until you are 25. For us, it's downhill from here, isn't it? But actually for children, it's still developing. Now, you're not going to be fully developed in that skill until you are in your mid-20s. So if you think about this from a child's point of view, we're asking a child of primary school age to sit in a classroom where they have to keep their attention on something. They have to resist the impulse to stand up and find something more fun. They have to organize their own materials. They have to work out what comes next. That is a huge amount of skill for even us as an adult, but it's even more difficult because they've not necessarily even developed the full neurological compartments, if that's the right word, to be able to do this. So their brain might not actually be ready for the tasks that are in hand. And that's particularly the case in a particular skill called working memory. And we mentioned this before. Working memory is your ability to hold something in your head whilst you do something else. For example, if you get a list of instructions or a list of things that you need to do, you have to hold it and then work through that list bit by bit. It's a particularly difficult skill, but we all know this is an area that children find very challenging. Think about a real example that you might see. How many times have you said perhaps to one of your kids, you know what, just go upstairs, take your clothes off, put your pajamas on, come downstairs, and then we'll talk about it. And then, you toddle off and do something. And then half an hour later, you think, where's my child? So you go upstairs and you see them in their bedroom, still in their clothes, I don't know, putting Lego up the nose or something, because that is something that's much more engaging for them. And you think, what are you actually doing? Whereas that looks like an attentional problem. It looks like they've not listened to you. Whereas the reality is that is an overloaded working memory. So their demands are too high. That was 5 instructions: upstairs, clothes off, pajamas on, downstairs, let's talk about it. And I think that the capacity to be able to do that is particularly challenging. There's something that's taught to us as when you're learning psychology, that in working memory, in theory, you can remember 7 things plus or minus 2 at any one time. I've always sat there and gone, 7? It's more like 1 for me at any one time, and I need lists to be able to help. But that's particularly difficult for children to do. So that can lead to the forgetting instructions, tasks not being completed, appearing distracted. But we know that this is a neurological difference, not an attentional one.
Yes, and I can see a lot of people in the chat are asking lots of questions, and we're going to hopefully touch on lots of things that you're saying, but we're going to also be talking about practical strategies with everything that Daniel has just been saying as well. So moving on to sensory processing and attention.
And again, this is another area that is thrown into the mix here that we have to consider when our child's not engaging with something. Because if you think about how children interact with their environment, whilst yes, it might be about what you say and speaking and what you see, there's also a huge amount of sensory information that's there as well. So think about, say, background noise. Noise is quite hard to filter out. For some people, that is the sound of just people breathing or chewing, that real quiet noises that can sometimes go right through you. For other people, it's louder rooms or rattly rooms. Think like a toilets in a school. They're quite echoey, for example, or a canteen, it might smell. So there is the noise, there is the smells. There's also the physical sensations as well. consider labels on clothes, fabrics that might rub against your skin, or seams on socks, which for one child might not even seem like a thing, but for another child that might be exceptionally overwhelming. Now, if you're thinking of all of that cognitive stuff we mentioned, the working memory, the executive skills, now add in the sensory processing, that is a huge load on your resources. So that's going to lead to mental fatigue. You're going to have tired, exhausted children. Their attention is going to be reduced. Their irritability is absolutely going to go up. So what looks like distraction, what looks like them not listening, could be a sensory overload as well.
Yes, I can just see in the chat that some people can hear other people in their same row. I just want to say that if you can hear other people, you can move rows by clicking on another row, but also just make sure you've muted yourself as well, which is a little green icon. It should turn red. So thank you so much. Okay, so another question. So is my child distracted, or are they overwhelmed by what's around them?
Yeah. And so we're talking here about there are reasons why children might be not be paying attention, and now we're in a position of saying, well, what is it? Children, no child's going to turn around and go, excuse me, mum, I'm completely sensory overwhelmed at any one time. We have to work out what's happening here, and you can sort of see differences. So for example, distraction might be I see it almost like a pull away from something. So children are distracted because they're being pulled somewhere that is more engaging, more stimulating. Think homework versus Roblox, for example. They're understimulated by the homework, and they're being pulled to Roblox, which is much more pleasurable, I suspect. I've never played the game myself. But then the opposite is what I would see from being overwhelmed, which is more like a crush on the systems here. Your child's receiving too much input. So it might be sensory or something else like cognitive or emotional, like their anxiety, but their brain's capacity is being crushed under the weight of dealing with all of that. And so we need to try and see what's going on here. You can spot the difference between them. So if they're distracted, they're just engaged with something more fun. But if they're overwhelmed, their whole body language changes. They're much more tense. They might glaze over. They might feel irritable or snappy. So you can see a lot of the differences.
I'm thinking now a bit more about attention and anxiety and how that impacts focus.
Yeah. And so I just mentioned anxiety. This is another element to be considering here, because being anxious has a huge impact on your ability to perform in any set of circumstances, and particularly maintain your attention on something. And of course, we're talking about children tonight, but that absolutely affects us as adults. Think about it. If you're worried about something, it has a high chance of affecting your performance. And that's because your brain is shifting away from the task itself onto feeling safe and secure. You're prioritizing safety over learning. You're shifting from the task to what's a threat here. And so that can look like you're zoning out of a task. You're avoiding things. It can mean it's hard to start something or engage with something. And so we often say that an anxious brain is often a distracted brain. So if you find yourself doom scrolling on something, for example, then maybe think about, is this just you need to switch off for 10 minutes from something, or is this because you're trying to avoid some difficult feelings or procrastinate about something? Is this an attentional problem or an anxiety problem?
So another question here is, how do I know if their lack of focus is ADHD, anxiety, or something else? And I can see in the chat that someone also mentioned trauma, which we're going to come to later on.
Yeah. And so, and we will have a bit more of a think about neurodivergence a bit later, because that's what ADHD is. It's a neurodevelopmental difference. It is a different wiring in the brain. So children will perceive the world differently. So I see ADHD a bit like the engine, if you will. It's your brain's engine that is constantly seeking stimulation. So it needs something more to keep itself going, something exciting to keep itself engaged. So a child with an ADHD might not be engaging with one particular task because they're constantly looking for the next thing that is rewarding. So it's the engine that's craving something more rewarding. Whereas anxiety is like the alarm system. Something's wrong here. It's a nervous system response. So it's your brain ringing, saying, danger, there is a threat here. You're looking for whatever might be going on. So a child with anxiety might drop their focus because their capacity to attend to something is completely consumed by worry. You can't focus on doing a maths test when you're worried that something bad's going to happen to you.
So thinking now about strategies that parents can implement.
Now, strategies are always an interesting one because there is no fix all. There is no the answer that says, do this and you'll be fine. We're not super nanny, and nor should we be, because everyone's doing their own thing in their own way for their own family's circumstances. But our job is to try and think about, well, probably the things that we've tried together haven't necessarily worked. So maybe we need to see this from a bit of a different perspective. And so now we know about all of that neurodevelopmental stuff, the working memory, the executive skills, the anxieties, the sensory. Well, that's where these strategies can come into it. So, for example, instead of saying 5 instructions at once, let's break them down one by one. Let's go back to our example. Please go upstairs. Now they're upstairs. Thank you. Now let's take your clothes off. Brilliant. Now let's put your pajamas on. Fabulous. So it takes a lot more time, a lot more effort, but you're breaking it down step by step. And actually it helps to engage on that particular task. Making things visual, lists, timers. I mean, we do this as adults all the time. How many people set reminders on their phones, alarms, post-it notes, prompts? You're moving it away from just holding it into making it much more accessible. There's a really lovely idea called body doubling. It's probably not what it sounds like. It's just more about being with your child, just sitting with them, because your presence can actually be very calming. Not always. Sometimes it can have the opposite effect. But you just being alongside them shows, I'm with you, I'm engaging with you, I'm trying to understand what's going on for you. So you're trying to connect with them, and that can also help to engage on a particular task. Similarly, language demands, and we might talk about words in a little bit. That's how we communicate. We talk through words. We give instructions. We share celebrations. We talk about sad things through words. But often what happens from us as parents to children is we direct language. So we say, put your shoes on, take your coat off. Why are you doing this? These are all big, demanding phrases that we might expect children to be able to deal with. But if they're struggling with any one of those areas that we talked about before, those phrases are going to be met with shrugs or resistance. So we use something called declarative language, which might sound a little bit fluffy, but instead of saying, put your shoes on, you could say something like, we're about to go outside. It's a bit wet on the floor, so we just need to think about what's going on there, which might sound ridiculous. But in that moment with overwhelmed children, think about when you're going to school, you're going from a really nice, calm home environment into the cold, outdoor, about to go to school environment. That shift can be really overwhelming, and a simple request of please put your shoes on might just be too much. So we can try to lower it a bit. I'm also very aware that that example might be a bit tricky, because I know, especially for my kids, you've got 16 seconds to get out of the house before you're about to get caught in all the traffic. So the real world also takes over here. And then the last one is, we just added in, get a receipt. Essentially, if you say to your child, do X, Y, or Z, or please help me out with this, instead of just saying, do you get that? Or will you do this? Because they're probably just going to look at you and nod or shrug or whatever. Ask them to say it back to you. What did I just ask you to do? What do you have to do here? Because then when they say it back to you, do you know that they've heard it, they've got it, they're engaged?
And I can see a lot of people in the chat talking about demand avoidance and children not responding and behaviours that challenge. And we're going to get to that later about regulation and co-regulation. So hopefully that can really answer some of your questions. So the next section is all about what's going on behind my child's emotional reactivity. And I also just wanted to note that if you still can hear people in a row, you just click on another row and you should be able to sort that out. So thank you so much.
Yes. So now we've talked about one of the possible reasons why a child might not be attending to something and listening, but that often is shown to us through their behavior and their emotions as well. And so we often see emotional outbursts from children, and these can feel exceptionally difficult for us to be able to manage. It's distressing, it's uncomfortable, nobody is happy about it, and it can be really difficult for us to manage as parents. And what hopefully we've been able to explain so far is that often these are not deliberate, planned, purposeful outbursts. No child is going to be sat in their room plotting, right, I now need to outburst at my sister. It might look like that because we think you've got the skills to manage this, but that's just how it's being shown to us. So it's a response to what's happening around them.
So another question here is, are these outbursts deliberate or something they can't control?
And I think that plays exactly to the point that we were just mentioning here. So I often see this as a distinction between can't versus won't. So it's a real subtle difference here. But essentially, when we see our children have an outburst of some kind, our adult brains assume this is a won't problem. They won't listen. They won't calm down. They are choosing to act this way. They are the devil. Maybe that's just me. But that is potentially a misconception or misinterpretation of what's actually happening, because from a psychological perspective, a neurological perspective, like we've been discussing, it is probably, in fact, almost always a can't problem. Because in the middle of some form of emotional outburst, a child, potentially even an adult, physically cannot control that reaction. So we have to look behind what's going on here. We have to find out why this is happening.
Absolutely. So thinking now about the brain under stress and what that looks like for children.
And this essentially is us starting to think about why this is happening. These are overwhelmed, stressed brains. And the way I try to imagine this is the difference between a thinking brain and an emotional brain. So we've obviously all got one brain, but it does two things really well: the thinking and then the emotions. And often they don't happen at the same time. So most of the time we are in our thinking brain. That is when we're calm, we're regulated, we're able to work things through. And when we are calm, we can still even talk about difficult things. We can have hard conversations, but that's what we need to have. We need our thinking brain to deal with things rationally, sensibly, logically. Now, when our stress levels rise, we are pumped full of cortisol. It's our stress hormone. And the more that happens, the more chance it is going to get into our brains, which then essentially switches off the thinking brain and switches on the emotional brain. And once your emotional brain is switched on, you cannot access the thinking. You cannot deal with rational, logical thoughtfulness. You deal with whatever the emotion is at the time, which is probably anger or frustration. So you cannot reason with an emotional brain.
So why can't my child listen when they're so upset or having a meltdown?
And that's exactly the consequence here, is that they are really upset, and you just need to say, you need to calm down, you need to stop, take a breath, or something like that. And we all know that's what needs to happen. We need to calm down. In the history of the phrase calm down, has saying calm down ever actually helped anybody calm down? And the chances are no, because you can't calm down. We all know you need to. So a brain is essentially offline. It is not working. And so we need to make sure they are safe. Number one, safety trumps absolutely everything else. But with safety, we can allow our children to engage with something that we can help bring that emotion down. There might be nothing else you can do other than allow them just to come down. That might take quite a bit of time, but you can use the magic phrase, one that I often use, which is, I'm here when you're ready. You validate the emotion. I'm here when you're ready. So essentially your children know that you're nearby, and when they are calmer, they're back into that thinking brain, then you can go in. And actually what you're doing is you're then rewarding calmness with your presence.
So another question here is, why does my child struggle to explain what's wrong?
Yeah. And so we've talked just before about why can't they listen? Well, the same thing applies for why can't they explain it. And so if you ask your children, what's going on, and they just shrug or say, I don't know, it might feel like they're just being a bit defiant, or they're not listening to me, or they're not responding. But actually, that's probably exactly what's going on. Their brains are probably worked up to a point where they just can't say anything, or almost don't have the capacity to be able to do it. That I would absolutely love to pick my kids up from school and say, how was your day? And they sit there and go, Dad, it was great. I loved this, or I hated this, or that one did this, or whatever. But what's the reality of what you get? How was school? Or worse. And so actually that is not my child not having the ability to say it. It's they're not in the right place to be able to say it. They've just come out of school and now they're in calmness, and they don't need more me. They just need space and time. It will come in time.
And that segues us perfectly into the window of tolerance.
And so this window of tolerance is almost the visual. We love a visual, Ruby, don't we? So the visual is the way that we can see, well, what area is our child in to be able to manage. So we talked about that emotional brain and a thinking brain. That's one way to visualize it. The window of tolerance is another one. We essentially want to be in that yellow band that's here. It's called the window of tolerance. Sounds great. But that is the calm, rational, grounded, in the moment, relaxed place. That's where we want to be. Now, if you go too high, you are hyper aroused, which essentially is when you often see those emotional outbursts, those meltdowns. It's the high energy. We're overwhelmed with the world that's going on. We're seeing threats. We're scanning for dangers. It's panic and it's scary. On the complete opposite side is what we would call hypoarousal. So you're essentially shutting down completely. You're backing off. So this is where the energy is gone. We are numb. We are tired. We're detached from everything. We cannot even speak. And we will absolutely go into that zone. And we will absolutely fall into the lower zone, the hypoarousal zone. That's going to happen. Our job as parents is to support our children when they are there, with a view to help them try and regulate it into that middle as much as possible. There's a question here that might answer what I'm about to say.
Yes, I think it will. So why does my child go from 0 to 100 so quickly?
Yeah, I cannot tell you how often this comes up, Ruby, is we often see, something like, they've been given the wrong coloured bowl and suddenly I hate you, and it's thrown and there's stomping and storming, and you think, oh my gosh, it's a red bowl. How on earth is that happen? Whereas this is one of the misconceptions about triggers, that we often are told to look out for triggers. What triggers your child? What triggers them? What sets them off? Whereas actually the trigger is almost a moot point. It could be anything that happens. I see triggers as the straw, essentially, that breaks the camel's back, to coin a phrase. The bit that's more important for me is all the stuff that has led up to that trigger. No child sits at a table and just immediately hates a red bowl. The chances are lots of things have happened all the way up to that red bowl, and it just so happens to be the red bowl that's then become that bit too much. So yes, the red bowl was the trigger, but all the stuff that leads towards it, the tiredness, the overwhelm, the stress, the workup of the day, all of that, which means it looks like they've gone from 0 to 100 straight away. They've just not started at 0. That's the way that I probably see it.
Yes, and we'll get to that later about that bottle effect, and we'll come back to that. So thinking now about strategies, because a lot of people are saying in the chat that they struggle with this, with hitting and with going mute. So some practical strategies here to help with those things.
It's so sad to see, because it's so hard to deal with, but it is something that so many of us have to deal with. And again, simply just changing your language, for example, is not immediately going to stop that overnight. Our job is to try and work towards it. But essentially, a lot of this has to be done with removing as much of all of that stuff that we've talked about so far and reducing those demands wherever possible. We want to focus on that calming things down before we reason with someone. Otherwise, they're in that emotional zone and you can't rationalize and reason with it. We want to calm that language, speaking slowly, lowering your tone, which is the complete opposite of how you're probably feeling inside. And an overwhelmed child has a very high chance of leading to overwhelmed parents because it is really difficult to navigate it. And so if we are feeling overwhelmed, it is really hard for us to then be calm and relaxed. This is the real world. And there will be times where you are not calm and relaxed and you shout and you scream and we know it doesn't work. So it's not as easy as simply saying, be calm. This is the real world. But actually our responses have a direct reflection on our children's responses and vice versa. So this is where that bottom phrase comes in. That regulation, that calming must come before reasoning, which is so easy for us to sit here and say, really hard to actually do in practice, but it also applies to us as parents. If we are not calm, then we will not be able to help our children calm in the best way. And there are lots of things that we can do. If there's multiple adults at home, tag turns. If you are feeling worked up, are you able to swap? If you are about to come into the house after a busy day, can you stop, take long, deep breaths by the front door, calm yourself where possible to then come into the house? I mean, again, they're not going to change the world, but they are just this idea of trying to become more regulated so that you're able to then help support your children through those things as possible, as much as possible.
Absolutely. So thinking now about why seemingly small things trigger such big reactions, which I've seen quite a lot of in the chat tonight as well.
Yeah. It sort of goes back, doesn't it, Ruby, about the plate example. You think this is a tiny non-thing, yet we are seeing such a massive response to it. And again, it's all because of all the stuff that's leading up towards it. And so it's the buildup of stress. It's the reduced mental space to be able to cope with everything, and which is why the trigger is rarely the full cause. So it's often called the Coke bottle effect. Think of a big bottle of Coke. A child wakes up, it's time to get dressed, shake the bottle. Let's go to school, shake the bottle. You've got maths, shake the bottle. Then you've got an English essay to hand in, shake the bottle. Then your friends don't want to play with you. So it's a constant shake up of your ability to cope. Now, if you think about that as a Coke bottle, that is getting more and more pressured. And what's going to happen? That pressure is absolutely going to build. And the moment they feel safe, it then explodes. That's the reaction that we're often seeing, that build up towards it. And so we want to try to reduce that wherever possible. So instead of getting that lid taken off and it explodes, can we poke holes in the bottle sort of thing and let that pressure release somehow or other? And that's what we can try to work on.
Yeah, absolutely. And we're also going to come to the about school as well soon. I'm seeing a lot of things in the chat about school and children coming home from school and meltdown. So we're going to get to that now as well. So after school collapse and how we can support.
Spot on. And this is the bit where you are seeing that Coke bottle explode. So children are often very able to hold it together in those structured environments, in a school-based setting, or even just out and about in public. Whereas, so to everyone else, it looks like they're the angel child. How many of us have got kids where the teachers at parents' evening said, if I had a whole class full of Susans, this would be, I'd be a happy teacher sort of thing. And you sat there thinking, oh my gosh, you have not seen what they're like at home sort of thing. And that is probably because they're working really hard to hold it all together. But all that's doing is shaking up their Coke bottle throughout the whole day. And so they come home and it is going to be released. Now, the visual of the Coke bottle is a huge explosion, but remember, it can be the complete opposite. It can be a complete shutdown and a withdrawal as well. So it can be meltdowns. It can be irritability. It can be withdrawal and silence and the mute that was mentioned in the chat as well. So I think this is reflecting safety. It's reflecting well-being, not defiance.
So you've gone into that already about why my child's fine at school but explodes at home. And could you just segue that also a bit into school avoidance and how that's linked? Because we
Yeah.
have quite a few people asking about that too.
And that's sort of the one of the more challenging consequences of exactly what's going on here. Because why is my child fine at school but explodes at home? The surface picture here is, well, they're great at school, they're managing really well, but they're really struggling at home. Whereas psychologically, it's the opposite. What I think is happening is they're finding it really difficult at school because of holding it all together, yet home is the safe, comfort, secure place. So actually the explosion at home is a sign of safety and security, probably showing your skills as parents, because you've created that safe environment. Now, I would love to have a much nicer way of our children showing what safety looks like, but this is the natural psychological response that often children provide, that home is safe. And so you see that explosion. And if we know that home is safe and outside of the house is not safe, the logical thing for children to do is avoid going outside. And that might seem like the right thing to do, but the moment we find our children not doing things, like avoiding things, there's a lot of variation here, by the way, a lot of reasons why children might not necessarily be able to manage the outdoor demands. But for many children, once we avoid something because it feels overwhelming, it becomes extremely difficult to then get back into it. And if that starts to happen for school, it can be very difficult to then get back into it. I mean, that's a very sort of generic line, because there are lots of children who really struggle with just the concept of school. It's not just simply a case of they've avoided it.
So thinking now about strategy, so how can we reduce these big reactions?
Yep. So again, it's little things that we can try and put in place just to ease that pressure, the poking the holes in the Coke bottle rather than taking the lid off the Coke bottle. So for example, can we build in decompression time after school? Can you, when you get home from school, have Susan time? I don't know where Susan comes from, by the way. I'm really sorry, Susan twice. But can we have that my child's specific time for them, which means no questions, no involvement? You know, they know we're here. They can go to their room and do something calming, not a screen. So screens can be regulating for many children, but the general message is using a screen is not helping them to deal with the everything that's going on. You're just pausing it. So you're pausing all of that distress. You're engaging with something fun like Roblox, Minecraft, Fortnite, whatever it may be, and then you're just unpausing it and then dealing with everything. Whereas what we want to do is then go into a room and do something that helps to decompress. Lego would be absolutely my go-to thing. Coloring, dot to dots, sewing, baking, making things, playing with dolls. It could be absolutely anything that is just a chance to just calm it down. And that's reducing those demands. And can we add in predictability? Can we add in routines? A lot of the time that's there. It's already there. It's just, that's why it might not necessarily be, it just might not be working, but we're allowing that safe space. And by doing so, we're shifting the narrative here from tell me what's wrong, what's going on, let me fix it, into what might they need, you know, what's going on to explain why this is happening. And we're shifting our view from problem behavior onto connecting with our children for that emotional regulation and support.
Thank you so much, Dan. I am seeing a lot of people in the chat sharing their strategies that they use. So please feel free to share any strategies that you're using that work, but also lots of people who are explaining their situation and just want to know that you can reach out to us and we can support you with those. If you're dealing with a complex situation, we won't be able to answer all the questions today, but please feel free to contact us. So on to section 4, co-regulation and supporting big feelings. So thinking about what is co-regulation.
Co-regulation is a term that is often used. I think it's often misunderstood as well. But essentially, it is trying to match your child's emotional state. So you could the idea is to match for you to be calm. and they come and match you where you are through your calm voice, through your calm presence, through feeling safe and secure. You're helping them to return to that regulated state. The challenge is it can also work in the opposite way, is that your child's up here, they're in that emotional brain, they're overwhelmed, and you are then being co-regulated to them, and you're being brought up here. That's the place that we want to avoid, and we want to bring it down here. So if we can remain calm, that can help them to then come down to that calmness. It might take ages, it might take time, but that's the place that we want to try and get to. So it's essentially an adult supporting a child's overwhelmed nervous system.
So when dysregulated, what should you not do?
And so if you're not matched, you're calm and your child's not calm, then the talking, the reasoning, the trying to deal with it, the telling them to calm down, all of the things that logically make sense or under perhaps any other circumstances would work, that won't work. So we need to come back to our magic phrase. And for those who've been on our webinars before or spent time perhaps with me, you'll hear connection before correction. We need to connect with our children by understanding what's going on here, by recognizing all of the things that might be happening before we can then make it better. Correcting it might escalate it.
And I know earlier today, Dan, we were talking about how difficult that can be for parents. So would you be able to just provide some insight into what parental support can look like in order to help parents do this effectively?
Exactly. And so often we know that children don't come with instruction books, do they? There's no manual that says when your child does this, then you can just do that. You see some of them presented to us, the super nanny type books of how do I help sort of thing, but that doesn't take into account the specifics of your own circumstances, because the challenges are you've probably tried the co-regulation and it might not necessarily be working. You've got the routine, you've got the calmness, yet it might not still be happening. So our job as psychologists is to try to support you as parents to try and understand why is this going on. It's so we can help you to then better connect in those moments. That's the aim, because sometimes it is not obvious, and especially if we're seeing big differences between what's going on at home versus what's at school, for example.
Yeah, absolutely. So am I reinforcing the behavior by comforting my child? So we get a lot of that, don't we, Dan, about gentle parenting and when to put in boundaries. What do you think?
I think this is a brilliant question, brave question as well, but it goes right back to the heart of the old school parenting advice. Just one generation ago, many of us will have had parents who parented us in a way of absolutely refusing to engage with anything like this. We heard the get over it, grow ups, deal with it, sometimes perhaps even more significant. But actually, that is because parenting was done via obedience. We want an obedient child. Our job now, we know what has much better outcomes for children is that of nurtured and safe and secure child. So this is trying to break down that old myth of if your child is acting out, you simply ignore them or you send them away to think about what they've done. But and the fear would be that by giving them a hug or something like that, you're rewarding the bad behavior. That only works with deliberate, calculated behavior, when they are deliberately, purposefully bad, which, as we've discovered tonight, that is not the majority of the times that we're talking about. It happens, of course it does, they're children. But actually, what you can't do is reinforce a flooded nervous system. Your job is to prove that you are there as a safe, solid, protective parent, and that means you're there to care even when things are really difficult. So you just being present and nearby when they're overwhelmed can be exceptionally helpful. You might not be able to engage with them, but just to validate that experience, to say, I get it, I can see you're upset, I know you're angry, even if it's met with get out, I hate you, that message still lies with them. And you take a step back and you just wait nearby-ish until that calmness come back, and then you go back in. You are not reinforcing the bad the bad in inverted commas behavior, you're actually reinforcing the calmness by then going back in by saying, I'm so proud of you for sharing that with me, or something like that.
So thinking now about some more strategies about what is helpful and what is not.
These are phrases that I really like. That I'm here, you're safe, that I understand. Anything that can validate their experience can help bring their attention back to that particular moment. They feel engaged with you, they feel connected to you. You're reducing your language demands. You're calm. Your presence is going to be exceptionally helpful. The phrase I use a lot is I'm here when you're ready, because you're essentially saying, now might not be the time, but as soon as you want me, I am here, and I love you and I care for you. And you're giving those gorgeous messages even when you might not be landing in that moment. The challenge is their reaction might make you just want to say something more. The intuitive response is to be saying, it's okay, I'm going to help, let's talk about it, we'll fix this together. It's too many words. And then when you're saying it, your voice rises. You become more, the psychological term is that of arousal. Your body is becoming more aroused, but that's an exceptionally overwhelming thing. You're becoming more stressed and worked up. You're trying to reason too early. We're going to add consequences in. If you don't calm down, then you will and actually none of that is going to land. It's only going to make things worse. So actually reduce everything. And that is the opposite of what feels like you need to do in that moment. All you want to do is put your arms around them and make it better. And sometimes you can't. You will do when the calmness appears, not in that moment.
So we're getting this question a lot in the chat. So how do I stay calm when their behavior feels so overwhelming? Yeah. And I know we've touched on that briefly already.
You know, the example that often makes you think about, on an aeroplane where they say, if the oxygen masks fall down, put yours on before someone else's. This is exactly the same situation. If your child is overwhelmed, you need to deal with your own feelings first. Again, we've talked about it. It's really difficult, but you will not be able to support them unless you are feeling calm and regulated yourself. So, when people yawn and it's contagious, so is overwhelmed emotions. It passes between people really, really easily. So our job is to almost separate ourselves from it and do everything possible to try to breathe through it and be calm. If you're not feeling right, that you're feeling overwhelmed by it, take a step out. It's okay, and then you can come back into it. But the bit I also want to add to this is, if you are not calm and you do shout back at your children, or you do say things that later you think, oh gosh, I shouldn't have said, or I shouldn't have done that. It's okay, because we all do it. The issue here is not the shouting back. The issue here is, how do you correct that afterwards? It's the connection before correction. So you going back to your children afterwards and saying, I'm really sorry, Daddy shouted, I didn't mean it. I was feeling upset. Firstly, you're showing you're human. It is okay, especially for boys. That's particularly important. But also, you are showing that it's okay. We will get angry, but we will deal with it together and we'll manage it. So we want to stay calm. It's not always an easy thing to be able to do.
And in this section, we're going to be talking about, what you can do, how you can utilize school and different services, but also when you should look into any underlying difficulties. And we're going to be touching on neurodivergence and anxiety, which I know a lot of you have asked in the chat.
Yeah.
So thinking about, how do I know if their behavior is just a phase or something more? And in our service, we get this a lot, don't we? When people are calling up and asking us about assessment and therapeutic support.
Yeah. And actually it goes back to even the thing we were saying at the very beginning, like, are we just overreacting to a normal behavior here, or are we actually missing something crucial? And that's where lots of families approach us, say we need an assessment for autism or something. Before we jump into assessments, we want to be looking really carefully at what might be going on here. This could be called the FID test. It doesn't really roll off the tongue. So the 3 pillars is a better way of doing it. But essentially, we're looking at the frequency, the intensity, and the duration. Essentially, if this is just a once a month thing, that might tell us this might be related to menstrual cycles. Perhaps if it's something that's happening every single day, it might be something to do with school. If it's happening at specific times, it might. So you can see patterns and how often this is happening. Is this an intensity thing? What does the intensity look like, especially over a period of time? Is it getting worse? And the duration, how long is it lasting for? And if all these things are becoming more frequent, more intense, lasting longer, then perhaps this is not just a phase, there is something else underlying. In addition, what's the impact here? Is this actually starting to affect our relationships at home? Is this meaning you are walking around on eggshells as a parent just to avoid the potential that you might then upset someone? Does this affect our children's abilities to maintain or to form friendships? Are their academic performance, is it dipping or changing? What's their confidence like? So we can look at all these different areas. And if all of these are being affected, there's almost like a tick next to all of these, perhaps, and not always, but perhaps there might be something else underlying here.
So thinking about that, what that could be now, Daniel. So
yeah.
where does that come into it, and how do we know if there is something underlying?
And so when we say something underlying, it could just be all of those overwhelmed systems, of course, but it could also be something that we call neurodivergence, which essentially is the overall umbrella term that says our children's brains are wired a bit differently. Now, we're all neurodivergent. It's such an odd phrase to use because we've all got different brains. It's just that the majority of us can perhaps deal with this way that the world works, and that's how schools are set up, and that's how services are set up, and that, so it's and we call that neurotypical. Whereas actually there are some children and adults where our brains aren't wired this way, they're wired this way. So we just need to make it's the language of difference, not disorder or condition, for example. And so that might be what's going on here. But again, before we jump into assessments of trying to work this thing out, we have to take a step back and say, well, we've got to remember that anxious children might look like ADHD behaviours because they can't sit still. They can't attend to a task. Well, that can happen with anxiety. A child who's really struggling to manage the demands of school, well, they might be struggling with their learning or engaging with it before we go into the autism as a potential reason. So there are similarities here. But again, let's go back to the FID test or the 3 pillars test, where we're saying, are we making changes, but the changes aren't working? If we're trying to support our children's learning, but the problems are still there, then it might not just be a learning difference. There might be something else going on here. And the bottom one on there is life circumstances. This is particularly important because unfortunately, things happen in life that we might not plan, we might not want. Families separate, we might lose loved ones. There are changes that might be unexpected, and sometimes those changes can be very significant, and that would be regarded as a trauma, perhaps. And we know that a response to trauma can have, again, very similar reactions into our attention and concentration and our focus and our engagement with things. So we want to be able to fully understand it so that we can support it.
So thinking about that now, how can we fully understand it and what can we do?
Yeah. And so you can pick up the phone to us at any time, even if you're not sure if we need to go into an assessment. You can chat with us to find out, is there something going on that we might need to look at in a bit more detail? And what we would probably recommend is let's think about this over a bit more of a period of time. Are there patterns that we're seeing here? Are you seeing different things in different settings? What does school say about this? What do clubs and activities say? So getting that information from multiple places can be really helpful. I would absolutely recommend sharing your concerns with school as soon as possible. All schools have got a Senko, and many have pastoral teams where just raise your concerns. So at least your children are on the radar, and if they're not already, and it might be that schools say, we're also seeing this too, and they've just not yet been able to have that communication. But professional advice is not something to be ashamed of. We're here to help. It might be it goes nowhere. It might be, yeah, you're doing the right things. Keep an eye on it, and we'll see. But it might be that we say, actually, what you've seen here is consistent with perhaps autism, so we want to look into it in more detail. We will only ever recommend assessments if we feel it's appropriate. These are intensive, heavy-going pieces of work, so we don't want you to do it unnecessarily. But sometimes it's required in order to get that understanding of what's going on.
And Daniel, just based on the chat, would you be able to share some thoughts about what happens when school aren't cooperative or do not see the difficulties, or the child is masking? How would we, for example, manage that?
Yeah. This is a big part of our everyday job, because we know that many children are present similarly in multiple settings. And if you look strictly at the criteria, for example, there are diagnostic criteria about autisms and ADHDs. It says difficulties across multiple settings. And so if you see that a child's an angel at school, as we were saying, but they're really not at home, it's very hard for school to then say, right, we're going to put in X, Y, and Z support, because they just don't see it. Chances are that it's not about cooperation. It's a different perspective. For example, if we're watching like a sports game, you've got two teams. We all see the same event happening at the same time, but 50% of the people in that crowd are going to see it differently to another 50%. Our job as psychologists is to try to bridge that gap. So even if there are differences between home and school, or we are thinking as parents that school might not necessarily be seeing the severity or the significance to what we see at home, talk to us about it, because we can help bridge that gap. We want to be a collaborative team to make sure that we get the best possible support put into place.
So again, that kind of ties into this question that came up a lot actually in the submitted question. So what do I do if no one is listening or taking me seriously, including the SENCO or the teacher, or even a partner has come up in the chat a few times that, partners have got different perspective of what's going on.
Yeah. And they will. We all see things differently. Men and women will view things differently just by biology, but we also view things differently through how we're brought up. And that has a massive impact here. But if we think about schools, for example, emotions can be easily dismissed. So we sometimes need the data, the number of times that our children have been overwhelmed, the number of times, or how long it's taken just to simply do homework. Share this with school so that they can see this is what might be going on. But yeah, it's often called an invisible struggle. If schools or the healthcare services are not seeing the problems, you're dealing with this yourself. It feels like just no one gets it. No one understands.
So
sorry, Ruby, please.
No, I was going to say, so when should somebody seek out professional support, whether that's an assessment or therapy or parental support?
Yeah. And that's exactly what we're here to be able to offer. Is actually, we've tried all of these routes. We've spoken to school. It still isn't working. We still need to get the right help into place. So can we seek that support, maybe through an assessment or speaking with someone, to get that understanding, to get that clarity, to make sure that my child is able to go to the right school and with the right provision, the contents of their EHCP is accurate, the teachers have the right support in place. That's our aim, and it's done by getting that understanding of what's going on. And remember, assessments are not just about what's different. It's also about celebrating strengths. These are things that our children are brilliant at, and we want to bring that out of them, so we're not focused only on when things go wrong and what support.
So you've touched on this question already, haven't you, about will a diagnosis make a difference? And do you want to
exactly? And this is the conflict that many families can find themselves in, and that we worry that getting a label, essentially like an assessment for autism, will result in a diagnosis and a label. That's the purpose of it. But I want to reframe it. It's not just about, do this test and here's a label. It's essentially like a roadmap for working out what we need to do to help our children navigate the world around them. So it doesn't change who your child is, doesn't change their brilliance or their challenges or their differences. It changes how the adults around them understand them. And often, sometimes that understanding needs different accommodations where they're only accessible via a diagnosis. So we're essentially providing an instruction manual. So the assessments aren't just do this test, you get a diagnosis. It's a thorough, deep dive into all the things that we've talked about, all those previous slides. We're assessing all of that so we can come up with a crystal clear picture. That's the aim of what might be going on. Diagnosis or not, we will still provide that understanding of what's happening here.
So before we finish off, we just want to say, firstly, a massive thank you to Dr. Daniel Weisberg for your amazing insights and advice today. But also, we really want to tell you that we have lots of events. So follow us on social media, and this is our WhatsApp QR code, and all the details will be put in the chat now by my colleagues of how you can contact us. But please do share your thoughts, and thank you so much, Dr. Weisberg. You have been amazing.
Oh, really well done. Thank you guys for joining. I really appreciate it. Scan the QR code, guys. You will get straight to our WhatsApp. You can have a chat with our chatbot. Have a good night, everyone. Thank you so much for joining.
Thank you.